Good morning. In today's session on VTE awareness, we discuss about VTE prevention in surgical patients who needs clot protection. Almost every week, I manage one patient who has gotten a clot post-surgery. Most are picked on time. However, there are a number where the clots are missed and present too late. So surgery saves life, but it can also trigger deadly clot formation if you are not protected. So it's important for us to know our risk so that you can have that discussion with your doctor before the surgery is done. So why does surgery increase the clot risk? Number one is immobility. Most times after surgery, there is limited movement, and with limited movement, the blood flow slows down, especially in the legs, predisposing to clot formation. The other reason is surgeries will also lead to injury of the veins. Surgery can damage the blood vessels, it can damage the vessel wall, activating the clotting mechanism. So as the body is responding by clotting, forms clots, and hence you can develop the blood clots. Remember, you get the clots in the legs, which can later move to the lungs, causing pulmonary embolism. The third reason is inflammation and stress. Surgery triggers inflammation and makes your body and your blood more prone to clot formation because of increased inflammation. And also finally, the procedure type. Some surgeries carry a higher risk of clot formation, like orthopedic, cancer surgeries, and also abdominal surgeries. So what are these high-risk surgeries for venous thromboembolism? The commonest surgeries associated with clots are orthopedic surgeries. So if you are undergoing any orthopedic surgeries, hip, knee replacement, spine surgeries, have a discussion with your doctor if you need blood thinners. If you're having any major abdominal or pelvic surgeries, any gynecological surgeries, you need to be on VTE prophylaxis. Any cancer-related surgeries, emergency surgeries with prolonged immobilization or ICU stay. So those are some of the major surgeries associated with clot formation, and we say any surgery that is taking a long duration, more than 1 hour, you need to be on prophylaxis. So who needs clot prevention? If you're over 40 years, if you have a history of previous VTE, if you have had a DVT or a PE before, or you have a family history of clots, if you are obese, if you are overweight, if you smoke, if you have cancer or you are on chemotherapy, if you have had prolonged hospital or ICU stay, and if you're on hormone replacement therapy, those are people at risk. So before any surgery is done, have a discussion with your doctor about your clot risk. So how do we prevent clots in surgical patients? Number one, a number will require blood thinners. We recommend for most of the patients, blood thinners should be given after surgery within 24 to 48 hours after surgery to reduce the risk of getting clots. We also encourage early mobilization. Walk as soon as your surgery is done and possible so that you decrease your risk of clot formation. You may also require to be on compression stockings. For some patients have high bleeding risk and we cannot use the blood thinners. So you will need to be on preventive measures like the graduated compression stockings. But for the majority of the patients, if you have had an orthopedic surgery, let your doctor put you on prophylactic blood thinners 24 to 48 hours after surgery. And this should continue until you are fully mobile. So before any surgical procedure, please have the discussion with your doctor. Should I be on blood thinners? And they should continue until you are fully mobile. So our call for action for today, planning for any surgery, do not hesitate to ask your doctor about your clot risk and what preventive measures are safe for you. So please stay tuned for our final post where we will discuss, can we stop and spot a clot now? And we will recap what we have learned in this VTE awareness series. Dr. Muthui-Mutua, saving lives one heart at a time.